Good evening, everyone, and welcome. Thank you so much for joining us on tonight for round 2 of COVID-19 vaccine conversations. This is a town hall tonight, and we are excited that you took the time to join us. This town hall is being brought to you tonight by the Action for Justice Collective organization. They are a collective of business and community leaders who work to influence and enhance political, economic, and the justice system to bring change to our schools, change to our families, and change to our communities. So the Action for Justice Collective organization has come together. They've come together to bring this information about the COVID-19 vaccine to the Black community. And tonight they've partnered with some faith communities. They've partnered with the Open Door Mission, True Light Church. And we hope that you all are gathering around your devices so that you can get this information. We have some amazing guests with us tonight, some amazing panelists who are here. They are qualified, they are knowledgeable, and they're going to share their wisdom and insight about this vaccine that so many of us have so many questions about. So if you are watching, I'm going to ask you to do me a favor. Do me a favor, go down to the bottom of your screen and hit that share button. Share with somebody that you know, share with somebody that you love, and let them know that we are here. And listen, you guys are getting this information for free. It is invaluable what you're going to hear and what you're going to learn tonight. So we want to encourage you, be a part of the conversation. This is a conversation for the community. And the goal of this conversation is to provide us with information so that we can make the most informed decisions about whether or not taking the vaccine is the right decision for us. We want you to be able to make an informed decision about that. So make sure that you are putting your questions in the chat. If you have any comments, put it in the chat, and listen, be a part of this town hall conversation. We also want to mention that this conversation is happening in partnership with State Representative Kinsey tonight. His office is also partnering with us to bring this information to us. So we're going to get this conversation rolling. This is what we're going to do. We're going to bring on Elder Kevin Campbell. He is a professor and a leader in the faith-based community, and he's going to come on and just really lay the ground for us tonight. As many members of the faith-based community is joining us for this conversation, he's just going to lay the ground. So we're going to ask him to come on and share with us tonight.
Hello and good evening. Thank you. I want to say thank you, first of all, to our sponsors, our State Representative Kinsey, to the Open Door Mission, True Light Church, and also to the Action for Justice Collective, to our moderator, and to our other panelists. I had to chuckle when they told me I had 5 minutes. It's hard to limit a minister to 5 minutes, but I will do the best that I can with the time that I have. And so tonight, I want to offer a faith-based perspective on the administration of the COVID-19 vaccine. And the first thing that I want to say is that it all starts with God, because God has the power to heal. In Exodus chapter 15, verse 26, it says, "I am the Lord that heals you, Jehovah Rapha." And I believe that God wants us to be healthy. However, we live in a fallen world that is susceptible to sickness and pain. God made the heaven and the earth. He made man and placed everything in the earth to sustain and maintain human life, even the ingredients for medicine. And I believe that science has its place, but ultimately God is above all. He gave us science to better understand the world around us. And God gives wisdom, and all wisdom ultimately comes from God. Psalm 103, verse 2 and 3 says, "Bless the Lord, O my soul, and forget not all his benefits, who forgiveth all thine iniquities and heals all your diseases." God can heal us from any sickness and disease, and no disease is beyond God's power to heal. I'm recently doing a study in Luke chapter 4 where we see Jesus in the synagogue reading from Isaiah chapter 61 verses 1 and 2. And in that passage, he says, the Spirit of the Lord is upon me and anointed me to preach, to heal, and recover the sight to the blind, which is both physically and spiritually. And in that same chapter of Luke chapter 4, Jesus healed a man with the demon. He went and healed Peter's mother-in-law and every one of the sicknesses that people had. And so this is actually a great chapter for us to read on healing to strengthen our faith. Well, what does the Bible say about all of this? Well, first of all, when I read scripture, I found out that there is non-exemption. Being a Christian does not exempt us from sickness. Just ask Job, ask Hezekiah, Paul, and Lazarus, just to name a few. I also read scripture and found that there are medicines used in scripture. The woman with the issue of blood had seen many physicians before she touched the hem of Jesus's garment. In Isaiah chapter 38, verse 21, Isaiah had said to Hezekiah's servant, make an ointment from figs and spread it over the boil, and Hezekiah will recover. And as I look through scripture, I see that not everyone is cured the same way. I want to speak briefly to those who have reservations about the vaccine. Some Christians believe that they're not going to take the vaccine because of its composition, because they believe that it is composed of fetal cells. I believe the other panels may speak to this, but based upon my research, this is not the case. Some people have reservations because of the history of distrust of the government. And unlike the Tuskegee experiment, this is not a private experiment. For the Washington Post reported that the Moderna trial had 37% people of color that participated. Some people of faith are hesitant to take the vaccine because they believe that it's the mark of the beast. But when you read Revelations 14, 9 through 13, and even into chapter 13 of Revelations, the mark of the beast is an identifiable mark. It is a symbol of 666, and it's associated with the worship of a person. And many in history have been tied to this person in the last day, and they've all been wrong. And so as I began to think about this, if I'm going to share in this forum, in this town hall, I did some research of history of Black doctors, and I just want to share this with you as you begin to make this personal decision. Dr. James Durham, born 1762, never had a degree, but he helped with yellow fever. Dr. James McClure Smith was the first Black doctor to practice with a medical degree, and he worked alongside Frederick McDouglass. Dr. Rebecca Crumpler, the first Black woman to earn a medical degree, was born in 1831. We all know Dr. Charles Drew, who pioneered blood transfusions. Dr. Maya Adelaide Logan, first open heart surgery performed by a woman in 1943. Dr. Alexa Kennedy, the first African-American neurosurgeon. And then last but not least, Dr. Kismika Corbett, a woman of faith, a viral immunologist who helped develop this vaccine. And she's not a hidden figure, but she is prominent and well-studied. I can speak to this issue because I too suffered from the coronavirus in last year. I had the virus last year and I spent 9 days in the hospital. But I am grateful to the doctors and nurses that cared for me. I watched as the news reported the number of deaths as they steadily began to rise, not knowing if I too would be counted in the number. But there was a nurse who befriended me and came in each day to take my vitals and help nurse me back to health. She was from Romania, and I took that opportunity to tell her about the love of Jesus, and she's now a friend of mine on Facebook. So as I begin to close my minute or two, making the decision, what do I advise? Pray and seek God first. If you need a scripture, 2 Chronicles 16 and 12 talks about King Asa of Judah, who had a disease in his feet, and he did not seek the Lord. Seek truth. Cross-reference what we will hear tonight from other panelists with what you may find in your own research. Isaiah 53 and 5 says, he was wounded for our transgressions, bruised for our iniquities. Chastisement of his peace was upon us. Our peace was upon him, and with his stripes we are healed. As I close, I am praying for all the families impacted, the doctors, nurses, and first responders. As we work our way through this pandemic, it is my hope that God's will be done. Thank you for your time.
Thank you so much, Elder Kevin Campbell, soon to be Dr. Kevin Campbell. Thank you so much for sharing that information and for laying that foundation for us tonight, and just for all of the information that you brought to the table and helping to ease a little bit of the angst that people from the faith community may have about taking the vaccine. So thank you so much for sharing with us tonight. As we move forward in our conversation, I want to remind you that if you are going to engage with us, and if you have a comment, feel free to put a comment in the chat. But if you are going to ask a question, please put the letter Q in front of your question, because we're going to do our best to answer your questions in real time. So if you have a question, put a Q before your question, and your question may be read tonight and may be answered. So we're going to move forward in the conversation tonight. We are also very blessed to have Dr. Lola Fagbami with us. Dr. Fagbami is a Harvard grad, and she's currently an infectious disease research fellow at the University of Georgia. She has experience with developing the vaccine, and then she's going to talk to us about the chemical makeup of the vaccine. So she's going to come in and share with us tonight. And I want you to really listen. As I said earlier, this information is invaluable. So make sure you share this. Tell somebody. Tune in and get all of this free knowledge so that you can make the best decision for your life about this vaccine. Welcome, Dr. Fagbami.
Hello, thank you, Minister Mines, and I am so gratified to be here and eager to be of use and of service to the community. Just a quick correction, I was not involved in the development of the COVID vaccine. However, I have a long experience in preclinical vaccine development at Merck Research Labs.
Awesome, okay, thank you for that clarity.
Are we good to go?
We're good to go.
I don't see my presentation. Wonderful. Hello. So yes, as Minister Mines said, I am here to talk about the development and the chemistry of the COVID-19 vaccine. And as we all know, the pandemic has changed our lives. It's turned our society upside down. However, there is hope, and the hope is in form of this vaccine that has been developed in the past year, and a lot of people have a lot of questions about it. Next. And that's a completely rational and valid concern. Even though 50% of Americans say that they have taken the vaccine or they will take it when it's offered to them, 31% of people are a little bit more hesitant, and that's because there's a lot of questions surrounding it. And what I'm going to do today is just give you a little bit of information and hopefully to help you make the best decision for yourself and your family. In order to talk about how the vaccine was developed, I just need to give you a brief history of coronaviruses. We know those viruses can cause serious disease in humans, and this is not the first coronavirus epidemic we've ever seen. In 2003 and in 2012, two different coronaviruses were identified that caused serious disease. The first, SARS, and something called the Middle East Respiratory Syndrome, MERS. And because these pandemics occurred, there have actually been previous efforts to make coronavirus vaccines. This effort that started last year was not the first time we've tried to make coronavirus vaccines. And based on these previous efforts, we learned that the coronaviruses have these protein spikes, and that it's these protein spikes that they use to enter the human cells. And another very important thing we learned is that human cells do not have the spike protein. And it's the combination of these two facts that helped us develop a very quick, safe, effective vaccine. Now, as we know, previously, please. As we know, in 2019, the second SARS the second SARS virus was identified. And I just really want to stress this one point. The first US death was announced February 29, 2020. That is less than a year ago. In that time, we have lost more than 500 million people. 500,000 of our fellow citizens, of fathers, mothers, brothers, sisters, friends, loved ones of all kinds. And that is the reality that we have, and that is what we're trying to stop with this vaccine. And we just have, as a society, we have a history of vaccines, from the smallpox virus, polio, measles virus, to the Ebola virus. That vaccines have been developed and in cases eradicated or eliminated the disease in many places. And when people stop taking the vaccines, for example, something like measles, the disease is actually resurgent. So vaccines are important. And because we have this experience with vaccines, when COVID showed up, the entire biomedical community reared into action. Next. The entire biomedical community reared into action, and over 100 different vaccine candidates were started in the pipeline with a variety of different technologies. And it's from those 100 that now we end up with, as the vaccines went through the development process, they start to fall out, either because of safety or because of efficacy. So we start out with more than 100 vaccine candidates, and all the way to the 4 that are licensed for use worldwide. This is data from the World Health Organization. And the other piece that's really important is, typically for vaccine trials, usually by the end of phase 3, only 1,000 to 3,000 participants are required from the FDA before review. The COVID vaccine trials engaged more than 30,000 people that have taken the vaccine during the trials, and they were proven safe and effective. Next. And another thing that made the vaccine development quite rapid is because in a typical pipeline, like when I was working in vaccine development, the pharmaceutical company waits until they have an FDA license to begin building the factories and manufacturing the vaccines. In the in the pandemic development model, which shortens the timeline, the governments of the world and different organizations guaranteed the risk of the production. It's called manufacturing at risk. And that and parallelization, because the risk was taken away from the companies, they started building the factories, they started the manufacturing process, so that as soon as the licensure had happened, the vaccines were ready to distribute. And it's a combination of all of this that helped us get the vaccine so quick. So how does the vaccine work? As I mentioned earlier, the coronavirus has the spike proteins, this red protrusions on it, that our cells do not have. And we know that this spike protein is integral to the virus actually being able to enter our cells and establish an infection. So what the vaccine does is it takes a piece of instruction to our cells, telling it to make this spike protein. So inside the vaccine is the mRNA, which is just a message. It's just a message into our cells that it goes down and makes those red spike proteins. As I said, human cells do not have this spike protein. So your immune system sees these proteins and freaks out and says, you're not supposed to be here. And it makes antibodies to the protein. And that's how the vaccine works. And this is important because the process of making the antibodies for the first time can take a little bit of time. That's when people get sick and then their body tries to mount an immune response. And if it does so in time, they might recover. If it doesn't do so in time, they wouldn't recover and not compatible with life. And that's how we've lost over 500,000 people. But once you've already made the antibodies, the next time that your immune system sees the protein, which in this case would be the virus, it springs into action and releases the antibodies that it's previously made really rapidly so that it prevents serious disease and death. So what is in the vaccine? As the mRNA vaccines, they contain the mRNA, which is what tells our cells to make the protein. And they also contain lipids. And we can think about these lipids as little bubbles of fat. And the purpose of these lipids is to protect the mRNA as it goes into our cells and actually helps the mRNA to enter our cells. And then it also contains some salts, very common salts, including table salt, including the salt form of vinegar. And these salts are meant to stabilize the vaccine, make it similar to the pH of our blood so that it doesn't damage our cells once it's administered. And then it also contains sugars, which is to keep these bubbles of fat, these lipids, from both sticking to each other and from sticking to the vial of the vaccines. A complete list of all the salts and amines that are in the vaccines can be found on the CDC website. As Elder Campbell said, what is not in the vaccines? There's no fetal material in the vaccine. There are no pork products, no animal products, no antibiotics. There are no microchips, I promise. There are no preservatives. What is in the vaccine is simply these items that I've listed, and that is what works. A very common question is, can the vaccine change my DNA? And the answer is no, because of something we call the central dogma of biology. There is a one-way street, and it happens in all life. DNA makes RNA, makes protein. It's a one-way street. As we know, these vaccines are mRNA vaccines. So they make the protein, which is what they're put in there. Since it's a one-way street, this mRNA cannot go back and affect DNA at all. It is just not possible. So the vaccine cannot change your DNA. Can the vaccine give me COVID? No, because as I've described now, the vaccine does not contain the virus. It does not even contain a piece of the virus. All it contains are instructions for your cells to be able to make the spike protein so that your body has advanced warning to make the antibodies before you actually get a viral infection. What about side effects? Most people will not have any side effects. And the most common side effects are pain, swelling, maybe fevers, headaches. And this is good because it means your body is mounting an immune response, and they will go away in a few days. And the very important thing to compare with the side effects is whatever side effects you do experience, which are very mild and minor, is nothing compared to getting COVID and having to be hospitalized, potentially needing dialysis, potentially needing a respirator, potentially needing to be intubated. So that is the risk when you're comparing the side effects. It's the side effects of getting the vaccine versus the side effects of getting COVID. And a lot of questions, there's now all these vaccines. There are 2 licensed in the United States, 6 licensed all across the world. Which should I get? And the answer is whichever one is right in front of you. Even though we've heard the top line numbers, this one is this effective, this one is that effective, and that's effective in preventing infection, which is fine. But the purpose of the vaccines is to prevent serious disease or death. And every single vaccine that has been approved, people that were vaccinated, not a single one got hospitalized for COVID, not a single one died from COVID, and not a single one died from the vaccine. The vaccine is safe, the vaccine is effective, and it's here to help us. And it's here to help us end the pandemic. By getting the vaccine, you can prevent yourself from getting ill or dying. You can prevent yourself from spreading it to others. You can prevent it from spreading through the community and help us get back to a near normal state and end the pandemic as soon as possible. So yes, we can end the pandemic, but it will take every single one of us to do that. I am available for questions. As you have questions, you can type them up in the chat. And as we go through, I'll try to make sure that all of them get answered. Thank you very much for your time and attention.
Thank you, Dr. Fagbami, for doing such a thorough job in helping us to understand how the vaccine was created. And one of the things that you said during your presentation, when you talked about is COVID in the vaccine, is the virus in the vaccine? To be honest, I thought that there was a little bit of COVID in the vaccine in order to build up those antibodies. So thank you so much for sharing that information and for making it clear. We are looking forward to talk to you a little bit more when we bring the rest of the panelists into the conversation.
Thank you.
All right. Right now, we have some of our state representatives joining us. We're going to start out with State Representative Stephen Kinsey. He represents the 201st District. He joined us in our last conversation. He shared a lot of good information around how Philadelphia is handling the distribution, allocation of funds as it relates to the vaccination. And one of the things that I really loved about what I loved hearing from Rep Kinsey was that, you know, they're fighting to make sure that this vaccination is available in Black and Brown communities. And I don't know about you, but I'm glad that we have people at the table that are advocating and making sure that there is equity, there is an equal distribution so that people in our communities can also access this. So Rep Kinsey, I'm sorry, there's a lot of doctors on here tonight. Thank you for joining us. How are you?
Great. I'm great. Thank you for having me also, Precious. And I want to also thank the Action for Justice Collective for putting this forum together. And, you know, it's interesting as I heard Elder Campbell speak a little bit earlier. And then you just mentioned this whole thing about equity. Unfortunately, I don't think we're there just yet. You know, we're fighting for it. And I know that we'll later hear from our Democratic leader, Representative Joanna McClinton, who's definitely leading the charge on the Democratic side. But let me just give an overview of Pennsylvania. Then I want to narrow it down because as you talk about equity, I think it's important that folks understand where we are. And I'm talking about people, Black and Brown folks in particular.
Absolutely.
But you know, when we look at Pennsylvania, and we're talking about 67 counties from Philadelphia to Pittsburgh, we're talking about a total of 922,990 COVID cases. The total number of those folks that are currently hospitalized is 1,972, and those are folks that are currently hospitalized. And out of that 1,972, we have 433 that are in intensive care. Now, when we look at the state, again, statewide, there have been a reported number of 23,868 deaths due to COVID. So as we move now from COVID into the vaccination, let me just talk about Philadelphia as an example. You know, Philadelphia has a bunch of different zip codes, and you know, you can go from Mount Airy or Chestnut Hill all the way down to South Philadelphia, and in between we got West Philly, Southwest Philly, North Philly, and so forth on. But when we looked at zip codes, and we're talking about the vaccination rate right here in the city of Philadelphia, zip code 19138, which is East Germantown, predominantly African American community. Well, the city reported that there was 1,662 folks that received the first dose in that zip code, and 455 folks that received the second dose in that zip code. Now, again, remember, that's a Black community. Right next to East Germantown, you have Mount Airy, zip code 19119. 3,209 folks have received the first dose. 1,072 received the second dose. So here it is, we're comparing a community that's less than a mile apart. One's predominantly African-American, the other is predominantly white. And we can see that there's a disparity in regards to the number of individuals that received the vaccine. You know, take it a step further, North Philadelphia, zip codes 19133, 815 people received the first dosage, 169 received the second dosage. Now, you compare that to, let's say, a zip code like Center City, 19104. 4,162 folks in that zip code received the first dosage. 2,474 received the second dosage. So I just did that from a view of a zip code. Now, keep in mind, you know, those zip codes aren't totally Black and aren't totally white, but they're predominantly Black or predominantly white. So then when we look at the gender, and again, this is all in Philadelphia, out of the folks that received either the first or second dosage, 62.4% are females, 37.6% are males. So we see that females are getting a dosage more frequent than males. And then let's just break it down from a race perspective. And I'm just going to talk about Black folks, African Americans versus white folks. For African American females, 21.8% have received a vaccine, and 20.5% African American males have received a vaccine. When we look at our white counterparts, 54.2% females have received it, and 54.4% white males have received it. So as we talk about equity, we still have a long way to go. And again, I'm honored to work with leaders such as Representative Joanna McClinton, who's really leading the charge to ensure that African American communities, Black and Brown communities, have access to the vaccines as well. So I want to just end on that. I mean, there's some more statistics, but I'll be around, and I believe that you're going to have a Democratic leader to talk about that as well.
Yeah, we're going to leave you in the conversation. We're going to bring State Rep Joanna McClinton, who serves the 191st District. And as State Rep Kinsey has said, she is the House leader for the Democrats, a first African-American woman. It is still Black History Month, so we're going to just snap it up for that. And she is my sister, and she's my friend. So we're going to have State Rep McClinton come in and talk about the work that her office has been doing around leading this charge as well, making sure that our communities are getting access to the vaccine.
Thank you so much for having me, Precious. It's good to see you, Steve. I saw you a couple hours ago. Looks like one of us got on the turnpike. The others of us had stacked meetings for every hour on the hour.
Yeah.
But it's great to be here. Thanks to Action for Justice for organizing another important forum so that we can get our questions answered. So the biggest challenge that we have experienced from my district office, which for those who don't know, it's at 60th and Chestnut. It is open from 8:30 to 4:30 every single day. The phone number, it's 215-748-6712. We've been receiving calls about, just it not being enough vaccine. There's a real supply issue, and the supply issue doesn't start here in Harrisburg, but it actually starts in Washington, D.C. And for those who've been following this in the news, and I know there's so much going on all the time, our prior president did not make efforts proactively to just order enough vaccine from Pfizer, from Moderna. So that being said, our new president has put an order in, so that will help meet some of the supply, or meet some of the demand. I'm getting calls to the district office. I'm getting emails and, on social media, which I'm grateful for people reaching out on my personal social media, on my legislative Facebook page, people wanting to know where they can go and where it's accessible. And everybody has been telling folks the first thing to do is start with your doctor. Your medical history. If you have one of those special challenges with your health that puts you in a higher level, makes you 1A or 1B, start with your doctor's office. I know it's frustrating and everybody's concerned. And in fact, Rep Kinsey and our entire caucus is going to be meeting with the governor very soon to talk about this very issue and how it's impacting constituents across the Commonwealth, because we know that the Washington, D.C. folks have ordered more vaccine, but we want to talk about how it's going to be distributed going forward and whether or not there need to be policy changes that we can create here under the dome in Harrisburg. It may be that we need to create some policy to make sure that it's rolling out all right. Or it may be that the new task force that the governor just created about 3 weeks ago, in which I was happy to assign Representative Bridget Kozorowski from Lackawanna County. She's the only medical professional amongst our 203. She was a nurse for over 20 years. They're strategizing, we're strategizing, and we're also meeting with people in business, because folks who are in business, in certain businesses, not everyone, are experienced with logistics. So I've had a couple calls this week with members of chambers of commerce from all across the state. Everybody wants us to get back to normal, whether we're in government, whether we're in the faith community. We all are looking forward to what we used to be able to do and we took for granted. Oh my goodness, like we took it for granted, not having to say, where's my mask? We took for granted not having lipstick all over our face from wearing it with a mask off and on. We took all that for granted, but we are looking forward to, especially the doctors here tonight, getting in line appropriately so that we can get vaccinated, because that's one of the biggest steps in us returning back to normal.
Awesome. Thank you so much, State Rep McClinton, for sharing with us the work that is going on in Harrisburg and in our local legislative offices, because a lot of times, you know, people in the community are like, we elect these people into office and they're not really representing our needs and they're not really, you know, prioritizing the needs of the Black and Brown community. But we see tonight that we have advocates, we have people at the table who are focused on equity, making sure that we are not at the bottom of the list as it relates to receiving this vaccine. And we appreciate your work. We hope that you both are able to stick around and be a part of the conversations as we bring in our doctors to talk a little bit more about the vaccine. So I just want to give you, I'm just going to run down their names and I'm going to let them come in and we're going to allow them to introduce themselves. If you saw part one of the conversation, you know that the doctors that we have tonight have a lot of knowledge and information to bring to the table. Just to add on to what Dr. Fagbami has already shared with us this evening. I see you already are putting your questions in the chat. Just in case you just joined us, please feel free to put your questions in the chat using the letter Q before your question. We're going to try to get as many answered as possible tonight. And if they are repeat questions, just listen up so that we can make sure that once it's answered, we don't have to keep repeating the same question over and over again. And so who do we have on our panel tonight? We have several doctors who will be joining us. I'm going to introduce Dr. Paul Stevens. He's a pediatric cardiologist. He takes care of children, and he has had to service children who have had the COVID, who had the coronavirus over the last year or so. And I'm also going to introduce his wife for him. Talk about a power couple. Dr. Tyra Stevens is going to come in, and she's a subject matter expert around the COVID-19 vaccine. She's been working on the vaccine advising committee. So I'm going to ask them to just come in really quickly and share a little bit about what they do around the vaccine.
Good evening, everyone. Thank you so much, Precious, and our members of our Action for Justice Collective. We appreciate this opportunity to speak with our community. So I'm a pediatric cardiologist at the Children's Hospital of Philadelphia, and there's a myth that COVID does not impact children. That's a myth. It's not true. Children not only are at risk for getting COVID, but they also are at risk for getting a condition called multi-inflammatory system in children, in which the various organ parts are impacted by COVID. It happens a few weeks after COVID, and it can be a serious condition, and it impacts obviously children and us in cardiology, because many of those children, about 50% of them, can have cardiac dysfunction, which is why I'm interested in this disease, of course, and why I'm very concerned about our community being under-vaccinated. So that's why I'm here tonight.
Hi, I'm Tyra Bryan Stevens. Thank you all for having us. I'm a pediatrician as well, and I serve on the Vaccine Advisory Committee for the city, as well as the Racial Equity COVID Vaccine Committee as well. So my interest is in preventing deaths and hospitalizations. And we know right now that those hospitalizations and deaths are really affecting Black and Brown communities more. And so we know the vaccine is the answer to reducing that. And we want to make sure everyone knows what they need to know so they can get the vaccine as soon as it's available.
Awesome. Thank you. We look forward to talking to you more in just a few minutes. Next, I want to introduce Dr. Shelley Henderson. Dr. Henderson she's also a Harvard grad, and she's currently a second-year resident at Penn Family Medicine. She's focusing on improving care for underserved populations. So we're going to bring her in and quickly allow her to share the work that she's doing as it relates to COVID-19.
Hello, thank you so much for having me. I just absolutely love that this forum even exists. So again, I'm Shelley Henderson. I work in family medicine, so that means we take care of everybody. We take care of babies, we take care of adults. I also do prenatal care, and we deliver infants. So we see COVID in all of those areas among my outpatients. On the labor and delivery floor, when we have moms coming in who are COVID positive, and also in the hospital and in the emergency room. So having experienced, people who are asymptomatic and trying to struggle with, delivering their baby, and do we need to separate them for a period of time, to people who are intubated and in the ICU. My goal is to really get this information out here to all the patients that I care for in West Philly, but patients all over the city, and especially our Black and Brown population, to ensure that they have access, they have the information they need, and they have access to this vaccine to prevent them from being those patients in the ICU.
Absolutely. Thank you so much, Dr. Henderson. Next, we're going to introduce Dr. Jose Terradas. Dr. Jose Terradas was an ER doctor, and when COVID-19 crisis hit, he shifted to working specifically on the crisis and making sure that that people had access to testing centers all over the city, regardless of what zip code that you work in. He is also a COVID subject matter expert. So, Dr. Jose, thank you for joining us this evening.
Thank you so much, Precious, for having me, and to the Action for Justice Collective. Absolute honor and humbling to be included on a panel of this magnitude, I'll say. I thought we had it pretty good last time, and then they went ahead and doubled down on getting the heavy hitters out. So I'm truly honored. My name is Jose Terradas. I'm a ER doctor by trade. I grew up in the Delaware Valley, so Philadelphia is in my heart. Ever since coming back from paternity leave, essentially, I've worked almost singularly in terms of trying to help open up testing sites in Black and Hispanic communities. I'm a national spokesperson with the Hispanic Medical Association, as well as the American College of Emergency Physicians, and I do medical analyst work on Spanish and English radio and TV, both locally and on the national level. Right now, the company that I work for, called IV Medical, I'm the director of testing and vaccines with them. We actually just submitted an RFP to the city to set up 2 large vaccination sites, specifically in those 2 zip codes that Representative Kinsey mentioned.
Wow, we need that.
Yeah, with the intention to be able to vaccinate 500 people a day, over 40 events, to try to get to 20,000 Black and Hispanic people inoculated. Because at the end of the day, I mean, we can focus on the African American community. That's 44% of Philadelphia residents. Hispanics make up about 15%. So we need to make sure that this majority that we have doesn't get treated like the historical minority that we always have been treated like.
Absolutely. Absolutely. Thank you so much. I just kind of got chills when you talked about working on those vaccination centers in those communities. And I think, snaps to you for helping to lead that charge. All right. I'm going to bring Elder Kevin Campbell back. I'm going to bring in Dr. Fakbami and State Rep Kinsey, State Rep McClinton. We're just going to have a big old conversation with everybody here, because I think everybody has perspective to bring to this conversation. And so if you didn't get a chance to watch round 2, I'm going to encourage you to go to the Action for Justice Collective Facebook page, and you can watch part 1 of this conversation. I'm sorry if you didn't see part 1. You can watch part 1 of this conversation. We laid a lot of groundwork in helping to dispel some myths around just COVID-19 period, and then around the vaccine. So we're just going to build on that tonight, as we know that the vaccine has been given out over the last couple of weeks. So there's been some development over time. And so we're going to start with a few questions, and then listen, we're going to kick it to the audience. We want you to ask your questions tonight and to get your questions answered. All right. So let's just start with questions around how how effective the vaccine is. So many people want to know, is it effective around actually preventing people from getting COVID? Will it stop you from getting COVID-19? And I'm going to start with the Stevens. I'm going to kick it to y'all, and y'all can just start us off tonight.
You want to go?
Yeah, sure.
So, it's definitely effective. It definitely works. So when we look at the 3 vaccines that are available right now, at least in Philadelphia, when we look at Moderna, we look at Pfizer, and now J&J, all of them are effective. For Moderna and Pfizer, over 90%, and for J&J, close to 90%. So definitely it's worth it. There really are minimal side effects that Dr. Fakbami already mentioned. So it's the way to go.
Yeah, the vaccine is extremely effective, not only at preventing you from contracting COVID, but is preventing you from getting a very serious case of COVID and dying from COVID. We both have been vaccinated. I'm pretty certain that all the doctors on this town hall have been vaccinated already. We and most likely have had both doses as we have, and we're still here. You know, people are getting this vaccine. They're walking away from the vaccine. They're living with the vaccine. And they're doing just fine. And you can't say that for this disease process. As Dr. Fagbami mentioned, it's over 90% effective. That's huge when it in terms of vaccine efficacy. You know, people get annual flu shots, and the flu vaccine doesn't do as well as this vaccine has done. So in my mind, this is hate to say it, but it's a no-brainer to get this vaccine.
If I may jump in and really to complement Mr. Stevens' point, the table that I showed was about getting serious disease to be enough to be hospitalized or die. In terms of infection, the numbers that you see, 92%, 95%, almost 90%, those are actually just getting the infection, which that's important. But the real point of the vaccine is to make sure people don't get seriously sick or die. And for all the vaccines that are tested, as I showed you in that table, not a single one has been recorded. So that's really important. Even if you do get a COVID infection, it's going to be a less severe disease, as Dr. Stevens just said.
Awesome. And so many times tonight, you guys have said that there are very minimal side effects. And we'll talk a little bit about for those who may be on some other medications. We'll talk about that in a second. But are you aware of any deaths? We just want to put this out there. Are you aware of any deaths? Any of the doctors can take this, of anyone who may have died from taking the vaccine, directly correlated to the vaccine?
Directly correlated, no. There have been cases that have been mentioned in the press in which there has been somebody who has passed within a certain period of getting the vaccine, which gets a lot of people talking. Those ought to be investigated because what we want is honesty and transparency, but there has been nothing that has been directly linked to the vaccine in terms of death to that extreme.
Awesome.
Can we talk a little bit about because the question may come up, what about these new strains?
Yep, that was my next question.
Okay, so the vaccine actually protects against the new strains as well. It's not to the same degree of what's called efficacy or protection. And I think in Great Britain with the AstraZeneca vaccine, they're finding that vaccine is actually even protecting against the B.1.1.7 British variant that a lot of people are afraid of. So it's still effective, not as effective, but in Great Britain, they already started working on a new vaccine that will cover that. And they expect to introduce that in the United States later this year. So, and they actually started working on that for the new strain back in December. So Dr. Fagbami may want to talk more about the new strain.
Yes. The only thing I just want to harp on, these efficacy numbers are about actually getting the COVID infection, which is important. But the actual thing about COVID is that it's killed 500,000 people. Every single person that has gotten the COVID vaccine, as Dr. Jose said, not a single one has died from taking the vaccine. The vaccine will prevent you from dying or from getting seriously ill enough to be hospitalized. You might still get the infection. That's what the 90% is. That's what the 70% is. That's what the lower efficacy against the different variants are. But so far, based on the information we have, it looks like in terms of preventing serious disease, in terms of preventing death, all the vaccines are work just as well on the new variants as on the primary strain. And this is good, like just the information we have, because this is an ongoing pandemic. All of us, the scientific community, the medical community, the lay community, we're all learning all the same information at the same time. So things might change. It's the reason why there were some things that, oh, they told us to do this, and then they told us not to do this, because we are all learning about this all at the same time. And with the information we have, once we get better information, the recommendations might change, and that is fine. That is great. It would be worse if like the information changes and we're like, no, we've always been doing this and we're just going to keep doing this and not actually follow the science. So as of right now, based on the information we have in terms of preventing serious disease and death, so far the current vaccines work just as well on the different variants that have been identified. But again, this is continuously being monitored.
Go ahead, Dr. Henderson.
Just to add on to that, so as we're thinking about all of these other variants, I know we are all kind of, you grow weary and well-doing, right? We're tired of masks, we're tired of social distancing. But when you're thinking about how these other variants are growing in the UK and South Africa, it's a reminder that we need to continue to do those things, even with the vaccine. So yes, we know that the vaccines are effective in preventing serious illness, but we also know that many of these vaccines are less effective against some of these variants, especially the South African variant. So if we're diligent in, continuing to wear our mask, continuing to social distance, getting the vaccine to decrease our chances of getting COVID, we can prevent those variants from, becoming the new majority here in the US. So I just want to point that out.
And thanks, Dr. Henderson. And Dr. Henderson made a very important point there. And that is, the more virus that's in the population, the higher probability that new variants will spring up. Viruses are just like, they're trying to survive, just like we are trying to survive. In the same way that we look for various techniques to beat this virus with all the preventive things that we're doing, viruses are trying to survive, and they look for ways to beat us. So the higher the numbers in the population, the more new strains will come up. So as Dr. Henderson mentioned, doing what you can to curb this disease in the population is actually going to lead to fewer and fewer new strains popping up. And I appreciate Representative Kinsey's comments regarding numbers. And what Dr. Fagbami said about 500,000 people. 500,000 people translates into, since this pandemic began in the United States, 500,000 people translates into one American dying every minute, every day. That's what that is. There have been 68 million Americans so far that have received this vaccine. And as Dr. Jose said, nobody has been known to die directly from the vaccine. So when you look at the risk of being not vaccinated compared to being vaccinated, you're going to walk away from this vaccine. You're going to live after this vaccine. And if you get COVID, there's a good chance, particularly based upon your age. There's a guy in my church that contracted COVID. He's 84 years, and he's a true blessing to our men's group. And we love hearing from him. And we are so grateful that he survived COVID, because he did. And he's the unusual person, because when you look at his risk compared to the baseline risk, which is individuals between 25 and 39 years of age, he has a 220 times higher death rate, his age group. So if you're an older male, if you're a Black male, it would behoove you, get this vaccine. Absolutely get this vaccine, because it could save your life, outside of potentially saving the loved ones, particularly older parents, grandparents that are in your life. It could save them as well. So
Absolutely. So you heard it. He said this could save your life. All right. So I have one more question before we really start to bring in the questions from the audience. And I think maybe our state reps or even Dr. Jose could chime in on this one. Let's talk about the management of the distribution of the vaccine in the city of Philadelphia. We know that already in the news, there's been scandal around who has been entrusted with distributing the vaccine. We've heard about the second dose being given as a first dose. And I think it's important to address some of those things because people in our community will say, see, that's why I'm not getting it. But if you guys can talk about maybe the checks and balances that's been put in place in order to help make sure that that people are being monitored as they distribute the vaccine in our city.
I'll take this one. So having seen how the Philly Fighting COVID scandal essentially rocked Philadelphia on a global level, I think that this has certainly caused the Department of Public Health and the city of Philadelphia as a whole to take extra steps to ensure that anybody who's entrusted with the distribution of the vaccine is doing it ethically, appropriately, but also staying true to what the objectives are. Based on what the Department of Public Health themselves are saying should be the objectives, which are community-based vaccination, in which we have to focus on those groups of people who have died disproportionately, which in the case of Philadelphia is going to be the Black and Hispanic community. So right now, there's a new RFP, which is essentially a grant proposal to the city in which the city has to have a contract and has to vet every group very tightly, which is something that was not necessarily the case the first time around, especially for a city like Philadelphia that has a lot of high quality, world-class medical facilities and universities and capable people who are willing to help. But we also need to make sure that we have a broad community-based plan that makes sure that we don't ignore that Black and Hispanic communities have died 3 to 4 times greater rates than their white and Asian counterparts, that they're communities who have distrust in the vaccine, who have a reason historically to distrust traditional vaccination campaigns. So we need to think outside the box of how we're going to reach them. And that's pretty much what's going on, at least at a broader scale in terms of vaccination management in Philadelphia. And they're getting their doses primarily from the state and then from the federal government as well. And there's been talks with FEMA recently about taking over the convention center to open up a site right in the heart of the city to ramp up the efforts and also to increase the supply chain that could come directly into Philadelphia.
I think one of the issues that folks should know around all of this is the number of vaccines we get per week, which is only 20 to 25,000. So we are limited in that. And so I'm really happy to hear about FEMA potentially giving 6,000 doses a day. That's going to, add another 40,000 vaccines per week to kind of our stock in vaccines. I think the important thing that we're all concerned about is who gets those vaccines. So the health department is looking at ways, as Dr. Jose said, to make sure that the most vulnerable populations are targeted. You already know about Black Doctors COVID Consortium, which will continue, as well as other sources. We are now, Children's Hospital is now vaccinating all the teachers in the public schools over the next 6 weeks. So we're trying to get the children back to school as well. We are also now actually vaccinating 16-year-olds and greater at Children's Hospital. So there's a lot of effort. There's not a whole lot of extra vaccine, unfortunately. So there's a lot of effort to really target those populations who need it the most.
Reverend Kinsey's muted.
So
Can you hear me? All right. So I just want to sort of add, and I want to sort of jump in on what Dr. Jose just mentioned. I've had the pleasure to work with Dr. Jose as well as the Action for Justice Collective. And what we formed locally was something called the Northwest Northwest COVID Coalition. I'm sorry, I'm thinking about another group. But we formed something called the Northwest COVID Coalition. It's a collaboration of elected officials, religious institutions. We also have medical experts such as Dr. Jose himself is a part of it, grassroots organizations like the Action for Justice Collective. And so when Dr. Jose talked about community-based in the contract, we also believe that there has to be a relationship, or I should say, for better yet, a partnership, because again, I'm not a medical expert, I'm a legislator, but yet as Leader McClinton had mentioned, folks are still calling our office. I mean, they're called their city council person, they're called their state reps, they're called their state senators, because the expectation is that we know what's taken place. So what we've done, what some of us have done here in the Northwest, is that we partnered with medical experts, and we started off with doing the COVID testing. We had an event at Martin Luther King High School, and we also selected some of the local institutions, not only schools, but also churches, working with medical professionals to give out the tests. Our intentions were to transition into making sure that the vaccine was giving out as well. And, there has to be accountability. We all saw what has taken place previously with the city and the other organization that got a contract to distribute vaccines. So we're trying to make sure that from a collective standpoint, not just elected officials, not just medical experts, but again, clergy, grassroots organizations, all work in a collaborative fashion to ensure that not only that the vaccines, even though we have a shortage right now, but making sure that the vaccines are coming into our local communities. But then also, in addition to that, making sure that those folks who truly need them first. I've heard Dr. Stevens mention that most of the doctors got them. I can tell you, as an elected official, folks have reached out to me and said, "Hey, are you going to get it?" Yes, I'm going to get it. But my belief is that I got so many folks in my community that need it much more than I do. So part of my role is to ensure, again, working with the Northwest COVID Coalition, to ensure that those folks get them first. I mean, I got a bunch of grandmoms and aunts and uncles and cousins that are much older than me that have coexisting medical conditions. Let's make sure that those folks get it. And in addition to that, part of our conversation is, as the city discussed these mass sites, well, we're also saying that we have a bunch of senior residential facilities or residential homes right here in our communities. They shouldn't have to get on a bus to go down to South Philly to the stadium, or go down to North Philly, to the stadium to get the vaccine. So we're trying to work in a collective fashion with our local hospitals. We're meeting with Rite Aid next week and other medical stores, to ensure other pharmacies, because we want to find a way to get that vaccine out to those that need it, but do it in a fashion where they don't have to travel 5 or 6 miles, wait in line, for 3 hours or 8 hours just to get this vaccine. So there is an accountability and a responsibility that I believe that we have, not only as elected officials, but as people who care about human life.
So I just wanted to share what we've been doing in my side of the city since Steve Kinsey's talking about the Northwest. I've got to hold it down for Southwest and West. And Penn Medicine has been very instrumental in doing an effort called Vaccine Collaborative. It's been Penn Medicine, Mercy Hospital, and a collection of faith leaders, interfaith leaders. I'm very blessed to serve a diverse community. We have a large group of African immigrants, Caribbean immigrants, Muslims. So we started off at Church of Christian Compassion, 8 a.m. 2 Saturdays ago, and 500 people were vaccinated, most of them faith leaders. This Saturday, it's already full, so don't show up. I'm not even going to say where it is. But this Saturday, we're going to be at a recreation center in my district doing the same type of thing with 750 doses. And I just got great news that we're going to do another one in West Philly. And so what I encourage people to do, and I know someone from my team is here, put that phone number down. So if you live, let me just say, if you live in West Philly and Southwest Philly, there's another event coming up. Call our legislative office, and one of the members of our team starting on Monday can get you those details so you can register. It's very important that we listen to these medical professionals. I'm a lawyer. I'm not anybody's doctor, so I can't give you medical advice, but listening to these medical professionals, I hope everyone is not afraid any further of being able to take one of these doses as soon as it becomes available to you. I also serve folks in Delaware County, and one of the things that Delaware County Council did was create a wellness center in my district in Yaden. So there's a wellness center in Yaden. They're about to open up a site on the other end of Delaware County in Chester. So there's a number there. So Chris from my office, if you could put that in the chat as well, because we want to make sure if you're living in Delaware County that you know who to call, that you get on the list and that you get registered. And the final thing I'm going to share for tonight is I know it's been a lot of frustrations and it's been a lot of patience required to get through this, to navigate through it, but we know it will not be like this always. But the biggest key to know is we want to be safe and protected from it. We don't want to just say, oh, we're going to pray, we're going to be all right. Like, we want to use the tools that have been given to us. And for those of us in the faith community, we know faith without works is, oh, it's dead. That's right. So we've got to have faith, and we have to also be wise and take the appropriate positive steps to save ourselves, our families. And I thank you all for this opportunity.
Great.
You're muted, Presh.
Thank you so much. I know that State Rep McClinton has to leave us, but thank you for your time. Thank you for sharing with us tonight. All right, let's go to the audience. Listen, we're going to ask these questions from the audience. We're going to ask our panelists to keep your responses as concise as you possibly can so that we can get as many questions in. And so Shakira Bent Pollard is asking, can you speak about the side effects that have been experienced? So we've already, Sharita, let's keep it moving. We've already talked about that one. Thelma Mays is asking, will this vaccine have any effects on people that is taking medicine, currently on medication?
I can speak to that. So one of the great things about the trials, they were so large that they included the drastic majority of comorbid conditions. So people with diabetes, high blood pressure, even people with HIV, hepatitis B, hepatitis C. For the most part, if you have it, it was probably included in the trial. The main things that were not included were patients who are, for the most part, patients who are pregnant, but we could talk about that if you have more questions, and then people who are immunocompromised. So for most of your medications, like, it's going to be perfectly fine if you're taking high blood pressure meds, if you're taking, metformin for diabetes, whatever it is, you're going to be perfectly fine taking this vaccine. The one thing I would keep in mind is if you've had significant, if you've had a history of anaphylaxis where you had a hard time breathing, or broke out in rash after taking like something else, it might be something that you just let someone know. In most places, they watch you for at least 15 minutes. But if you do have a strong history of allergic reaction, maybe you want to sit and make sure somebody watches you for 30 minutes. It is not something that happens often. But it is, something that can happen, especially for someone who's prone to it. Very small percentage of people experience that. But if you have a strong history of that, then I would just maybe think about making sure they watch you for 15 to 30 minutes.
So just to piggyback on that answer, so from the allergic reaction cases, 0 deaths. Almost all of them happened within 11 minutes. That's another important component of it. And with the allergic reaction component, again, a lot of these folks already had a history of it. So it's not that this just came out of thin air for many people. And with the last studies that came out, just to give you a specific number, for 1 million vaccines, 11 cases on average of a bad reaction. So 11 cases per million. That's pretty low.
Absolutely. All right. Our next question. And just in case you're just joining us, if you have a question, please feel free to put it in the chat. Make sure you put a Q in front of it so that we can identify it as a question. Jacqueline Harris is asking, I would like to know why AstraZeneca's vaccine requires 1 dose, and with Moderna and Pfizer, it requires 2 doses.
I will take that. And basically, first, the AstraZeneca, it's a different vaccine technology. And a lot of that was boosting up that top line number, preventing infection. As you might have seen in the news, recently there has been discussion and there's been increasing evidence that potentially 1 dose of the mRNA vaccine is sufficient to prevent, again, serious disease and death. Right now, the recommendation from the CDC is to take 2 doses of the mRNA vaccine. But basically, the reason the different vaccines have different doses is because of the technology used. The AstraZeneca is not a mRNA vaccine, and it's been tested, and the data has been reviewed by the FDA, saying the one dose is enough.
Awesome. Our next question. Pastor Karen Thompson is asking, if you've already had COVID-19, is it still necessary to get the vaccine? I'm going to ask the Stevens to take this one.
Yes, it's necessary to get the vaccine. We know that there's no harm to that. And initially, I think it was a little confusing because the CDC said if you had COVID vaccine, then you should wait for 90 days. And that really was to give folks who had no antibodies the opportunity to get the vaccine first. But there's really no harm that comes to you from getting the vaccine, if anything. And we also don't know how long those antibodies last. So if you had the disease, we're not sure how long that protects you. So it's important for you to get the vaccine.
They tell you to wait a certain, what?
2 weeks.
2 weeks after
14 to
symptoms
21
have
days.
resolved, right?
All right, next question. Tina Pollard is asking, there are 6 vaccines. Why is the U.S. only using 3?
If I may, that's a quick answer. Because the FDA has to review all of them. We don't care if it's being used in the US and the EU. The FDA has to look at them and say this is safe for our citizens to use. They are in the process. The other vaccines that have been approved are being looked at, including the AstraZeneca here. But we have to make sure that it's good for our citizens, and that's how careful the authorities are being about this.
And that's good to hear. Thank you so much for sharing that. Next question. Thelma is asking, my son has underlying conditions, and I want to know why he is in phase 1C or phase 1C.
I'll try to take that one. So when we're looking at, first of all, children do get COVID, and some children can die from MIS-C, but they don't typically get the severe disease that the adults have gotten. And then if you look at the deaths, it's very much adults who die from COVID-19. However, having said that, if your child is 16 years or above, we are vaccinating those with chronic conditions that have been predisposed to severe outcomes. So things like diabetes, immunosuppression, cancer. We're not vaccinating for hypertension yet. And asthma, I'm an asthma expert, and asthma, fortunately, has not been associated with serious outcomes from SARS-CoV-2. So that's the good news. If that was not the case, there would be thousands and thousands of children who need to be vaccinated. Also, there's no vaccine study that's ready yet for children less than 16 years of age.
Yeah, I think a lot of parents have had questions about that. I remember us talking about that the last time that the vaccine trials were not done on children under 16. And I know people have been asking, do you recommend, even when it becomes available, that their children should get vaccinated for, in that age bracket?
Yeah, absolutely. And the studies from 12 to 15 should be out soon. So I think that really soon the 12-year-olds and greater will be able to be vaccinated. But again, unless we get those 200 million doses, it's still going to be very much stratified by how serious the underlying disease is.
All right. Next question. Sister Lucille Booker is asking, how can someone who is not ambulatory be able to receive the vaccine if they are homebound? This person is on multiple medication that has residuals from a massive stroke.
So this is logistically probably the most challenging part of vaccination at the community level in Philadelphia, and what I'm going to assume is going to be globally. Because you can talk about these large centers that you drive to, or smaller community centers that you still might need to take public transportation or walk to. But then how do you get to those people who can't even get down a flight of stairs? And the problem here is because it's financially, it's also very challenging. there's not a lot of money that gets reimbursed for vaccine administration. And so there's going to need to be a lot of sort of grant support that comes to helping to subsidize vaccination of folks in the home. Some home health agencies or local pharmacies, or you even hear about stories of folks who come from like the local pharmacy, small town pharmacy that goes to vaccinate someone who's at home. But it is true that is logistically going to be a very difficult thing to get to, even when more doses become available.
And I also will piggyback on that to say that this may be a role for J&J because it's one dose. So as Dr. Jose was saying, assuming we can get those home health nurses trained and actually get the vaccine to the patient, this might be one that we would preferentially choose J&J. That way there will only need to be one trip to that home.
And then I'm wondering, I remember last time, I believe it was Dr. Shelley Henderson who spoke about the children who are underage who cannot be vaccinated, but you almost provide an incubation by having the parents vaccinated, and those who maybe live in the home to create that safe haven around the children. Could that also be true for someone who is an ambulatory for this time period until someone is able to get to the home?
Sure. Absolutely. Yeah.
All right, our next question, State Rep, were you speaking?
You're on mute, Rep.
Okay.
There
We
go.
can hear you now.
Okay, great. When Dr. Jose was talking about the costs, I can tell you that legislators are having conversations with Rite Aid, Walmart, Walgreens, CVS, and that was actually part of the discussion that came up. I mean, we have a lot of seniors who are not ambulatory and cannot get out. So we're having discussions in regards to looking to, have medical professionals, as was mentioned, to go into the homes of individuals. And again, it might be costly, but we recognize that there is a need. So there is some discussion about that at this particular time.
All right, our next question. Brother Robert Ackwood is asking, would the veterans community, even though a government entity, be considered as an area of priority that get proper amounts of distribution? Anybody want to take that one? Everyone looks perplexed.
Well, it's a good question. I mean, it's an interesting question. I think having military experience or being a veteran does not place you into a higher risk pool itself. I think that if you're drawing from the VA, for example, you're likely getting your source, because it's all about where the stockpiles at the highest level and who draws from that. So when we talk about FEMA coming into Philadelphia to create its own vaccination center, that's unique because they would be getting their own unique supply from the federal government that has nothing to do with the 20 or 25,000 doses a day that Philadelphia as a city is getting right now. So it is likely that the VA has some sort of arrangement at the highest federal levels to make sure that as an organization that they are getting represented appropriately and not left behind.
All right, let's go to our next question. Joanna's Educational Consultant Center is asking, is it safe for someone diagnosed with COPD to take the vaccine?
I can respond to that. I would strongly recommend someone who is diagnosed with COPD to get their vaccine. What that tells us is that your lungs don't have a lot of reserve. So if you get exposed to something like COVID, it's going to be very difficult for your body and for your lungs to be able to manage that. So I would strongly encourage individuals who have a diagnosis of COPD or other forms of lung disease to be vaccinated.
Absolutely.
All right, our next question. So Laurel Author is asking, how do you respond to individuals who are responding to misinformation and for those reasons have decided not to take the vaccine? What would you say to those people?
Think long and hard about where you're getting that information from. Think about how social media works in that revenue is driven by clicks and clicks are driven by sensationalism. So people get you to click by throwing out the craziest ideas there. think Elder Campbell addressed the fetal tissue issue directly. It's true, there is no fetal parts or remains in the vaccine at all. And so it's important there is just think long and hard who you heard it from. Can you verify that information through any other source? When you mention this information to other people around you, is this something that they've heard of? So don't just get your information in this bubble, even though we're in a pandemic and we're distant. Don't just get in that bubble. Really try to seek truth from as many sources as possible, because gathering as much data as you can, as much as possible, will only make your decision smarter.
Absolutely. Go ahead, Dr. Stevens.
I was just going to say cdc.gov has a lot of information on vaccines. So go there. There's a patient-facing one as well as one that, is for professionals. So regardless of who you are, you can get a lot of information there. And there's also information on the phila.gov website as well. There's a map there where they're putting kind of where some of the information that Representative Kinsey mentioned is on that website as well. So it's a good place to go to verify information.
And if I may, what I would say to them is the option is vaccine or COVID. That's what we're talking about. And if you get the vaccine, you'll likely not get seriously sick or die from COVID. And if you don't get the vaccine, you're more like, there's a higher chance that you'll get seriously sick or die from COVID. And that's the choice that you have to make for yourself. And the thing is, we're not going to get 100% of people to vaccinate. But really, for me at the baseline, and this is what I try to impress on people, that's the choice you're making between taking the vaccine and not getting seriously ill or dying from COVID, or not taking the vaccine and having the chance of getting seriously ill, of dying from COVID, and really seeing where you land on that for yourself.
And if I may, go ahead. I'm sorry. Go ahead, Representative.
Well, Dr. Stevens, I just wanted to add that, some folks have a distrust for government. I've heard, we don't trust the government. You got, there's a plot and so forth on. But, what I also say is talk to your local leaders. I mean, your faith-based organizations, your community leaders. We're not all in this. I mean, we're all in this together to simply save lives. We're not in here. I work for the government. I'm a government official. But the reality of it is that we care about people. This is not no experiment, as was mentioned with the Tuskegee group. This is really about saving lives. And, again, there's no doubt in my mind that there are local leaders who are really trying to inform folks, especially in the Black and brown communities, that, listen, folks, I got it. You can get it. It's about saving lives. This is not about the government trying to implant something in you so we can track you and know where you're going, know how much you're spending and so forth on. But, this is just a serious issue that we have to really recognize and do all we can to save lives.
Thank you so much for sharing that and really just making that plain. I know since the first time we had this panel, I've had several conversations with people because I feel like when you know better, you do better. And you want to try to educate people as well. And some people have given me that very same response. Well, I don't trust the government. I don't trust doctors. And I'm thinking, but you have pre-existing illnesses that you are actually seeing doctors for. So why would your doctor lead you right in that as it relates to that regard, but then wrong as it relates to this one? So thank you for just helping people to tear down those walls and thinking that any of the doctors on this panel have a special interest, that you guys are gaining anything from people taking the vaccine, that you are literally just committed to helping people get the right information to make the right decisions about taking the vaccine. So thank you so much for that. I think we have 2 more questions, and then I'm going to ask if there are any resources, any websites that you all want to share, any last information that you want to put out there as we get ready to wrap up this conversation. Then we can share that as well. So Jacqueline is asking about, is it safe for someone with scleroderma to get the vaccine? And then I'm going to add on to that. I saw a question earlier from Vendetta Johnson. She was asking about taking high blood pressure medicine. And so I know Dr. Henderson talked about certain medicines you may want to inform somebody. Could you just give us a little bit more clarity around not every single medicine that you're on, you may need to, tell somebody at the vaccination center, but there are specific medications that you need to tell somebody when you go to get a vaccine, what those are.
I think for the most part, most people are going to be just fine. Like if you have scleroderma, if you have COPD, high blood pressure, you don't necessarily need to go through your list of medications when you go to get the vaccine. If you have a history of being immunocompromised and you're on specific things for that, that's something you might want to let people know. And then one thing I talked about before is if you have, a significant history of things like anaphylaxis, just making sure that somebody is aware of that. But for the most part, just again, given the breadth of these trials, you won't necessarily need to go through your long medication list and then for most people with almost every condition, is going to be fairly safe.
Okay, thank you. I see another question from Charlene Colony Abrams that says, can you describe the difference in efficacy from an RNA-based vaccine versus a DNA-based vaccine?
So I'll take that. Currently, there are no approved DNA-based vaccines, so we cannot speak to the efficacy of them. We have the efficacy data for the RNA-based vaccine. If a DNA-based vaccine comes along and gets through the process and gets the data reviewed, then we could compare them. But as of right now, that is not a thing.
All right. Well, I'm going to give you all just a quick few seconds if there's any resources. I know Dr. Tyra Stevens just talked about the CDC website that you all want to share. If people want to learn more on their own, they can always, again, reference back these videos from today as well as our first conversation. I know there were a lot of resources shared during that conversation as well, but I'm going to digress if you all want to give any last words.
CDC.gov. It has everything.
Yeah. I'd like to give a last word of encouragement for the listeners out there. We understand where you are mentally. That is, a lot of you are thinking, we're a year into this. I have not gotten COVID. I have protected myself. I'm good. I can wait for the rest of y'all to get vaccinated and eventually we'll have herd immunity, but I don't really need to get this vaccine. I see in my clinic, when I have my outpatient clinic at the Children's Hospital, at least one or two families that walk in, their kid got COVID, everybody in the family got COVID. And in most cases, they were doing exactly what you're doing. They thought they were protecting themselves adequately, yet nevertheless, there was that one instance where someone visited and they got infected and the family got infected. In some cases, the grandparents got infected. So we get the mentality, we understand it. The only way, the guaranteed way not to get COVID is to lock yourself in a closet and just stay there until this pandemic is closed. I mean, that's almost a guaranteed way, but you're not going to do that. People are going to go out. People are going to do what they need to do to keep living. So you can safe-proof yourself. We, as the physicians and medical people on this line, we got the vaccine. You can use us as your test dummies, if you will, and we are fine. So I encourage you, if this night has converted you into receiving your vaccine, then do what Jesus said. We can get a little spiritual here. Become a disciple, right? Become a disciple of this group here. And in the process, you can save some lives, right? Because you as a community, and I don't know how many people are out there, you are much bigger than the 7 or 8 people that are on this line. And you can have a far-reaching impact by talking to those in your community and imploring them, encouraging them to go on and get vaccinated. It will shorten this pandemic and we'll all be grateful for it.
Amen. Thank you so much for that. I mean,
we're the guinea pigs, right? We are the guinea pigs as the medical community. We would not have gotten vaccinated if we thought we were going to get sick. So, we put ourselves out there. I am appreciative of that opportunity to have been the guinea pig, but we are all here and we would all recommend it. But as a medical person, as a science person, I would open it up to Elder Campbell and see if he has any final words for us in terms of, giving us something spiritual. Here, Elder.
Well, the one thing that I would certainly say is that we are very appreciative of the wisdom that has been shared here today. And I think the one thing that is really critically important is that we realize that God has really given us everything that we need As I mentioned earlier, people are healed in different ways. We appreciate the wisdom of our physicians, of our doctors, of our scientists. But I think that we are very hopeful that if we take wisdom, then we're going to be just fine. And I think that if we do that, if we exercise wisdom, everything is going to work out, and we're going to trust that God has really provided everything that we need. All the ingredients, as I said earlier, God has already put in the earth. And if we really trust Him, and if we really lean to His wisdom, I believe that everything's going to be fine. So I appreciate all of our panelists and what they brought to the table. Been very, very educational, and I just hope that we can walk away tonight really believing and becoming at peace. Really, this is about peace. Have whatever decision that you make, as I talked about earlier, you want to have peace. And when you pray and when you think about making a decision, you're really asking for peace. And it is my prayer that we would have peace, that this thing will be able to pass. Thank you.
Amen.
Awesome. Thank you again for all of you who have joined us tonight, for all of our panelists, to the Stevens, to Dr. Henderson, Dr. Jose, to Dr. Fagbami, Elder Campbell, to State Rep Kinsey, State Rep McClinton, and to the Action for Justice Collective for giving this time and space to have such a necessary conversation. Thank you. If you are interested in learning more about the Action for Justice Collective, you can go to their website, afjcollective.org. afjcollective.org. You can sign up for their mailing list, learn a little bit more about what they're doing in the community, and see how you can support, see how you can partner. Thank you for everyone who tuned in tonight. For those who have given great questions and great feedback and engagement in the chat, hit the share button once this have ended. Share this with somebody that you know. Have a conversation. The point of this is to start the conversation so that it can have a ripple effect in and throughout our community. Thank you for allowing me to host you tonight. It has been awesome and informative. I have signed up and I cannot wait to get the vaccine. So I just want to say God bless you to everyone and have a great, great evening.
Bob